What are the top 15 most frequently asked questions about Sculptra and Radiesse? Let's start today by diving straight into the science behind it and help you better understand which path might be better for you. Ready for the deep dive? Here we go. There is a question I hear in my consultation room with remarkable consistency. A patient comes in, usually somewhere between their mid-30s and late 50s, and they describe a feeling they cannot quite put into words. They know their face has changed. They know they've looked into the filler category and felt uneasy about it. And then they've read something, or a friend mentioned something, or they fell down a social media rabbit hole, and they arrive in my chair holding the word biostimulator like a question. I heard there's something called a biostimulator. Is that different from filler? Is that what I need? And if there are two of them, Sculptra and Radiesse, how do I know which one is right for me? It is a genuinely good question, and the honest answer is, it depends on who you are, what your face is doing, and what your goals are. But it depends is only useful if I explain what it depends on in enough detail that you can actually participate in the decision. What makes a biostimulator different from a filler? Before I can explain the difference between Sculptra and Radiesse, I need to explain the category they share, because there is still meaningful confusion in the market about what biostimulator actually means versus what a traditional dermal filler does. A traditional hyaluronic acid filler, Juvederm, Restylane, and similar products works through direct physical volume replacement. The filler occupies space in the tissue, you inject it, and the result is immediate. The volume is there. The mechanism is straightforward. More material in the space means more structure. When you decide you no longer want the filler, or when it eventually degrades, typically over 12 to 18 months, though this varies significantly by product and location, the volume goes away. The filler is metabolized, or it can be dissolved with an enzyme called hyaluronidase. A biostimulator works on an entirely different principle. Rather than replacing volume directly, a biostimulator triggers your own biology to generate new structural tissue, primarily collagen, which is the protein scaffold that gives skin and soft tissue their firmness, thickness, and structural support. The product itself does not become the volume. The product recruits your own collagen production to create that volume. This is why biostimulators are often described as working from the inside out. And in this case, it is literally true. The clinical implications of this distinction are significant because biostimulators rely on your own collagen building capacity. Results develop gradually rather than immediately. The timeline for full results varies between Sculptra and Radiesse, but neither delivers the kind of immediate walk out of the office transformation that a hyaluronic acid filler can provide. What they deliver instead is something arguably more valuable: gradual, natural-looking volumization that integrates into your own tissue architecture, that produces results that are harder for the outside world to detect as something done, and that lasts significantly longer than a hyaluronic acid filler. That trade-off, patience for longevity and naturalism, is the defining characteristic of the biostimulator category. This is why I believe biostimulators are often the more intelligent long-term investment for patients in their late 30s and beyond who are beginning to address structural changes in the face, and why I counsel patients carefully about the patience required before they commit to the category. The biology. Underneath, why collagen matters so much here. To understand why biostimulators work and what makes each of them effective, it helps to have a clear picture of collagen biology and why volume loss happens in the first place. Collagen is the most abundant protein in the human body. In the skin and soft tissue of the face, it is the primary structural protein, the scaffolding on which everything else is organized. Think of collagen fibers as a dense three-dimensional mesh embedded in the dermis and in the deeper facial soft tissue. When that mesh is dense, well-organized, and abundant, the overlying skin and soft tissue are supported. The face has volume, the contours are defined, the skin has thickness and resilience. We begin losing collagen at a meaningful rate in our late 20s and early 30s. By the time most patients come to see me with a concern about facial aging, they have already lost a significant proportion of their structural collagen, and that loss has been compounding for years. The process is not dramatic year to year, which is part of what makes it so insidious. It is cumulative. What you perceive as having happened to your face often reflects a decade or more of gradual structural change finally crossing a threshold where you notice it. In photographs, in your morning mirror, in the way people ask if you're tired when you're not. Sun exposure accelerates collagen breakdown through UV-induced oxidative stress and through the activation of enzymes called matrix metalloproteinases that degrade the collagen matrix. Smoking is one of the most potent accelerators of collagen loss in both skin and deep soft tissue. Hormonal changes, particularly the estrogen decline of perimenopause and menopause, accelerate collagen breakdown at a rate that significantly outpaces production. Significant or rapid weight loss, including GLP-1 related weight loss, deflates fat compartments that were providing structural volume in the face. It exposes the underlying collagen loss that was already present, and it creates the Ozempic face appearance I've written about separately. Biostimulators address this problem not by patching over it with a foreign material, but by reigniting the collagen building process that has slowed with age. Both Sculptra and Radiesse do this, but they do it through different mechanisms, different timelines, different locational preferences, different clinical profiles. Sculptra, the slow rebuilder. Sculptra's active ingredient is poly-L-lactic acid, typically abbreviated as PLLA. This is a synthetic, biodegradable polymer. The same family of materials is used in absorbable sutures and certain orthopedic implants. How does it work? When Sculptra is injected into the deep dermis or subcutaneous tissue, the PLLA microparticles are recognized by the immune system as a foreign but benign substance. The body's response to this recognition is a controlled inflammatory reaction, the same kind of cellular response that initiates wound healing. Fibroblasts, the cells responsible for producing collagen, migrate to the area and begin generating new collagen in and around the PLLA particles. Over time, the PLLA particles are slowly degraded and absorbed. What remains is the new collagen your own body built in response to the stimulus. This means that Sculptra's results are almost entirely from your own biology. The product provides the trigger. You provide the material. And because collagen production is a biological process that takes time, weeks to months to generate meaningful structural tissue, Sculptra results do not appear immediately. In my clinical experience, most patients begin to notice meaningful change at 6 to 8 weeks after their first session. The most significant improvement appears between 3 and 6 months after the final treatment session. The end result, when it arrives, looks exceptionally natural precisely because it is natural. It is your own collagen. Sculptra comes as a freeze-dried powder that must be reconstituted with sterile water before use. The reconstituted product is a liquid suspension. The technique for injection is different from that of hyaluronic acid filler, massaging after treatment, and in the days following, 5 times a day for 5 minutes for 5 days, which I teach every patient, helps ensure even distribution and reduces the risk of the nodule formation that was a more common complaint in earlier Sculptra protocols. In terms of how long Sculptra results last, the clinical data and my clinical experience suggest most patients see meaningful structural improvement that persists for 2 to 3 years or longer. This is not because the PLLA persists. It is fully degraded by 12 to 18 months. But because the collagen it induced continues to provide structural support for an extended period afterward. Annual maintenance treatments, starting approximately 2 years after the initial series, can help extend and maintain the results. The ideal use cases for Sculptra in my practice are diffuse volume loss across large areas. The temples are one of the areas where I use Sculptra most frequently. The temporal hollowing that makes the face look gaunt or angular is beautifully addressed by even, gradual collagen stimulation across the whole temple. The midface and cheeks are another primary area. Sculptra is particularly effective for patients who have lost significant structural support across a wide zone of the face, because its distributable liquid character means it can be evenly spread across large treatment areas in a way that point-specific filler placement cannot easily replicate. I also use Sculptra in the lateral face and preauricular area, in the décolletage for skin quality and structural improvement, and occasionally in the jawline and neck, though for these areas, Radiesse often has advantages I'll describe shortly. Some patients respond robustly to 2 sessions. Others, particularly older patients or those with more significant starting deficits, benefit from 3 or 4. Radiesse, the immediate scaffold builder. Radiesse works through 2 distinct mechanisms, which is part of what makes it clinically distinct from Sculptra. The first mechanism is immediate. The gel carrier of Radiesse provides immediate volumization at the injection site. You inject Radiesse, and there is immediate volume correction that is visible the same day. This is mechanistically closer to a traditional filler in terms of the immediate result, though the material behavior and longevity differ significantly from hyaluronic acid filler. The second mechanism unfolds over the following months. The CAHA microparticles act as a scaffold for collagen ingrowth, and as the gel carrier is absorbed over the first few months, fibroblasts migrate into and around the particle matrix. They generate new collagen that gradually replaces the absorbed gel with structural tissue of your own making. The CAHA particles themselves are eventually degraded through phagocytosis, and immune cells engulf and break down the mineral particles over 12 to 18 months. But by that time, the collagen framework has developed around the area. The combined effect is a treatment that delivers some immediate gratification. The visible volume from the gel carrier, followed by sustained structural improvement as the biostimulatory collagen formation develops, and the gel carrier is gradually replaced. Most patients notice an initial result the day of treatment. They experience some minor softening of that result over the following weeks as the gel carrier absorbs. And then they see a secondary improvement develop at approximately 2 to 4 months as the biostimulator effect matures. Radiesse's rheological properties, meaning the way it behaves physically as a material, differ from Sculptra in ways that influence where I prefer to use it. Radiesse has a higher viscosity than reconstituted Sculptra, which means it behaves more like a structural filler when injected. It provides more scaffolding support in areas where I want both immediate lift and longer-term biostimulation. This makes it particularly well-suited to the jawline, where I want to create immediate definition alongside the longer-term collagen induction, the lower cheeks, the chin, and the neck and décolletage, where it has demonstrated in clinical studies not only volumization, but genuine improvement in skin thickness, texture, and tensile strength. Radiesse is also available in a diluted formulation, sometimes called hyperdilute Radiesse or Radiesse in a carrier, in which the product is mixed with a saline and lidocaine solution to create a much thinner, more spreadable material. In terms of duration, Radiesse's gel carrier is absorbed over approximately 6 to 12 months, but the biostimulatory collagen effect extends the functional result to 12 to 18 months or longer in many patients. The hyperdilute formulation tends to have a more purely biostimulatory timeline, with results that may extend to 18 to 24 months in some patients. How I decide between Sculptra and Radiesse in practice. In my consultation room, the decision between Sculptra and Radiesse is rarely framed as a binary. For many of my patients, the more relevant question is not which one, but how much of each and where. Both products address different aspects of the same underlying problem, structural collagen loss, and their different physical properties and clinical behaviors mean they are often genuinely complementary. That said, When I am approaching a new patient and thinking about their treatment plan, several factors consistently guide me toward one product or the other. Degree of immediate volume need. If a patient has meaningful focal volume deficit and some desire to see a result before the biostimulator effect fully develops, Radiesse's gel carrier provides that bridge. If a patient is comfortable with a purely gradual result and wants the most diffuse, even outcome possible across a large area, Sculptra's uniform distribution profile is typically my preference. Treatment location. For the temples and midface, large surface areas where I want even, diffuse collagen stimulation, Sculptra is my first choice. For the jawline, lower face, chin, neck, and décolletage, areas where I want both structural scaffolding and biostimulation, Radiesse, often hyperdiluted, is typically my preferred option. The lateral face and preauricular area can go either way depending on the patient's specific anatomy. Skin quality goals. Both products improve skin quality over time as a secondary effect of their collagen-stimulating mechanism. For patients where skin quality improvement is a primary goal rather than or alongside volume restoration, I often lean toward hyperdilute Radiesse, immediate visual feedback. For patients who need or prefer to see some result on the day of treatment, for a wedding, a reunion, a professional event, or simply for the psychological reassurance that something is happening, Radiesse's gel carrier provides that option. Sculptra cannot offer day of visible change. Any swelling present on the day of Sculptra treatment is not the result and will resolve. Age and depth of collagen deficit. Younger patients in their mid-30s to early 40s with relatively mild structural loss and strong collagen building capacity often respond beautifully to a shorter Sculptra series. Older patients or patients with more significant starting deficits, particularly those who have had rapid weight loss, may benefit from a combination protocol using both products, addressing different areas with the most appropriate tool for each location. Patient preference for timeline. Some patients are genuinely unbothered by the gradual timeline of biostimulators. Others prefer to have some immediate result, even a subtle one, to help them track their progress and feel confident in the process. This preference legitimately influences my recommendation toward Radiesse when it holds in both directions: what to expect, sessions, downtime, and the treatment experience. Both products are formulated with lidocaine to significantly reduce injection discomfort. The experience is rarely described by patients as painful. Uncomfortable is the more common descriptor. For Sculptra, treatment sessions typically take 45 minutes to 90 minutes, depending on the number of areas treated and the volume used. Patients leave with some mild swelling and occasionally mild bruising, which typically resolves within 3 to 7 days. There are no restrictions that prevent most patients from returning to work the same day or the next day, though I advise avoiding vigorous exercise for 24 hours and scheduling important events outside of the first week to allow any swelling to fully resolve. As noted, massage 5 times daily for 5 minutes for 5 days following treatment is an important part of the Sculptra protocol. For Radiesse, treatment sessions are typically shorter, 30 to 60 minutes for most cases, because Radiesse provides some immediate volume. Patients may notice they leave looking somewhat different than when they arrived, though some of that initial result reflects swelling and will soften slightly over the following week before the lasting result stabilizes. Bruising and swelling are the primary immediate side effects. Most patients feel comfortable returning to normal activities within 24 to 48 hours, though I recommend avoiding strenuous activity for 48 hours and scheduling social events outside the first week to allow for any bruising to resolve. For both products, I advise patients to avoid blood-thinning supplements and medications in the week before treatment when medically appropriate. This reduces the risk of bruising, but does not eliminate it entirely. Neither treatment carries the kind of risk profile that requires significant downtime planning in the way that a surgical procedure would. These are lunchtime adjacent appointments for the vast majority of patients. That said, I always counsel patients that individual variation exists and that bruising, while not common, is possible, and that important events should ideally be scheduled at least 2 to 3 weeks after treatment as a conservative measure. Combination approaches and the multi-treatment protocol. The most sophisticated biostimulator protocols I design for patients are not single product plans. They are multi-step, multimodality approaches that address different aspects of structural aging with the right tool for each component. A complete biostimulator treatment plan for a patient dealing with meaningful facial volume loss and skin quality concerns might include Sculptra for the temples and upper midface, diffuse, even collagen stimulation across the large surface areas where the first signs of structural deflation are most visible. 2 to 3 sessions over a 3-month period, with results developing over the following 3 to 6 months. Radiesse or hyperdilute radiesse for the lower face and neck, structural scaffolding with immediate feedback for the jawline and lower cheeks, and skin quality improvement for the neck and décolletage, where skin laxity is a primary concern. RF microneedling, Morpheus 8 or similar, as a complementary treatment during the biostimulator series. This provides an additional collagen and elastin stimulus through thermal injury and mechanical microchanneling. The combination of biostimulator collagen induction and RF microneedling has additive effects on skin quality and structural improvement that exceed what either modality achieves independently. Medical-grade skincare, specifically retinoids, growth factors, or peptides, vitamin C, and sunscreen, as the foundation that supports the skin's collagen-building infrastructure and protects the results from UV-driven degradation. I think of this kind of integrated approach as building from the inside out and the outside in simultaneously. The biostimulators are addressing the deep structural architecture. The RF microneedling is addressing the mid-layer collagen and elastin network. The skincare is protecting and supporting the surface layer. When these systems are working together, the results are consistently more impressive and longer lasting than any single modality could achieve. What biostimulators are not? In the interest of setting accurate expectations, it is worth being equally clear about what biostimulators do not do. Biostimulators do not tighten significantly lax skin. If you have meaningful skin laxity, the kind that you can pinch and hold or that folds visibly when you move, collagen stimulation from a biostimulator will improve the texture and firmness of the skin over that area. Biostimulators do not address the surface features of the skin. Fine lines, texture, irregularities, pigmentation, or active acne. These require different treatment approaches. Biostimulators work at the structural level, not the surface level. Biostimulators are not a substitute for surgical procedures in patients with very advanced structural aging, significant skin laxity, deep fat compartment deflation beyond what collagen stimulation can address, or skeletal change from bone resorption. In these patients, surgery may be the most appropriate option, and I refer those patients accordingly. Biostimulators occupy an important position in the aesthetic medicine spectrum, but they are not the answer to every question, and biostimulators are not immediate result treatments. If you need to look dramatically different in 2 weeks, biostimulators are not the right tool. If you are willing to invest in a process that unfolds over months and delivers results that are indistinguishable from natural structural improvement, and that will last significantly longer than traditional fillers, then they may be the most valuable aesthetic investment you make. The safety profile, what you should know. Both Sculptra and Radiesse have been in widespread clinical use for nearly 2 decades, and both have well-characterized safety profiles at this point. The risks are real but manageable, and both products are considered safe when placed by experienced trained injectors in appropriate anatomic locations and tissue planes. The most commonly discussed complication for Sculptra, and the one that drove significant protocol refinements in the mid-2000s, is the formation of subcutaneous nodules. Early Sculptra protocols involved less dilution and different injection techniques than current practice, and nodule formation was relatively common in those early years. With current protocols, higher dilution volumes, deeper injection planes, and consistent post-treatment massage, clinically significant nodule formation is uncommon. I review massage instructions in detail with every Sculptra patient, and I follow up closely in the early post-treatment period to identify and address any nodularity early if it does occur. For Radiesse, the most relevant risk is intravascular injection, a rare but serious complication shared by all injectable products. The face is highly vascularized, and inadvertent injection of any product into a blood vessel can cause vascular compromise, or, in rare cases, skin necrosis or visual complications. This risk is addressed through a combination of proper injection technique, aspiration, low injection pressure, blunt cannulas where appropriate, and thorough anatomic knowledge, and is one of the central reasons why choosing an experienced physician-level injector matters enormously for any facial injectable procedure. Radiesse cannot be dissolved after placement, unlike hyaluronic acid filler, which can be reversed with hyaluronidase. This makes correct placement even more important and reinforces that Radiesse is not a procedure for the untrained or inexperienced. Sculptra is similarly irreversible in the short term, though nodularity can be addressed through steroid injections or, in rare cases, minor procedural intervention, realistic costs and timelines. Cost is a legitimate consideration in any aesthetic decision, and I would rather address it directly than leave it as a vague unknown. Sculptra is priced per vial in most practices, and a typical treatment session uses anywhere from 2 to 4 vials, depending on the treatment areas and degree of volume loss being addressed, ography, provider experience, and individual patient needs. But patients should realistically expect a meaningful investment over the course of the initial treatment series. Radiesse is similarly priced per syringe, and hyperdilute Radiesse protocols use different dilution ratios than standard Radiesse, which affects the per-treatment volume and pricing structure. In both cases, I counsel patients to think about the cost in terms of the duration of result relative to the investment. A quality biostimulator series that lasts 2 to 3 years represents a different value calculation than 6 months of hyaluronic acid filler at a lower per treatment price, but requiring more frequent replenishment. With injectables, as with most things in medicine, the relationship with the practitioner and the quality of the protocol matter more than the cost per unit. How we approach this at Lazuk Aesthetics. When a patient comes to me for a biostimulator consultation, I am not starting with a product in mind and working backward to justify it. I am starting with their face, their goals, their timeline, their medical history, and their preferences, and working forward to a plan that makes sense for them specifically. Sometimes that plan involves Sculptra, sometimes it involves Radiesse, often it involves a thoughtful combination of both, deployed across different areas of the face and body according to what each product does best in each location. Sometimes it involves starting with skincare optimization and RF microneedling before adding biostimulators to a tissue environment that is better prepared to respond. Sometimes it involves having an honest conversation about the fact that biostimulators are not the right tool for a particular patient's concerns, and discussing what alternatives might better serve their goals. What it always involves is transparency. You should know exactly what is being injected into your face, why that choice was made, what the mechanism of action is, what the realistic timeline is, what the possible side effects are, and what the alternatives are. That level of transparency is not just an ethical standard. It is the foundation of a clinical relationship that produces the best outcomes over time. If you are in the Alpharetta area and are curious about whether Sculptra, Radiesse, or a combination approach might be appropriate for you, I would encourage you to schedule a consultation, bring your questions, bring your concerns, and bring whatever level of skepticism or curiosity you're carrying about injectables. All of it is welcome, and all of it will help us build a plan that genuinely serves you. Stop guessing, start knowing. Lazuk Aesthetics, Alpharetta, your little secret.